diabetes is a disease of high glucose or high blood sugar, but the organ, well, the organs that's the second most affected organ in diabetes, okay, are your kidneys. A lot of people think heart disease, but it's really kidney disease. You know, a lot of the dialysis places that you see popping up on every corner in major cities, where people are going to the dialysis spa, where they're like going to a spa-like environment so that they can get hooked up to a machine, because their own kidneys are so coated with sugar they don't function as filters anymore, and so they have to go sit, you know, for 4 hours or 8 hours or however long their prescription is for. They have to go sit and they have to get dialysis for several hours a day, several days a week, in order to continue to survive, because their kidneys have been so damaged by that excess glucose. Now, I mentioned it's the second organ, right? The primary organ that gets damaged by blood sugar is the eyes. This is why a lot of diabetics go blind. They lose their eyesight, because the small microvasculature in the eyes, very tiny blood vessels, and it's generally speaking, when the blood sugar is high, it affects the smallest blood vessels first. That's where we start seeing the damage. So the eyes and the kidneys are the two areas that start to really show up as problematic for people who don't come to this type of conclusion. This, again, one of the reasons why no grain, no pain diet works so well when a person has diabetes is because the diet itself is about a third of the total calories are coming from carbs, or about 30% of the total calories coming from carbs, not the American Heart Disease Association, American Heart Association, 60 to 70% carbohydrate general recommendation. So again, lowering that glucose means we got to cut grain out of the diet, because this is what happens. Most people so vastly overconsume grains as a staple food in their diet that they're driving up their blood sugar, their blood glucose. This can happen with other starch-based foods as well. Things like potatoes can do this. If you're on a grain-free diet but you're eating too much tapioca, if you're eating too much arrowroot or too much yucca, like these are things that also will drive up your blood sugar. It doesn't have to just be grain, but again, obviously sugar drives up your blood sugar, but it's that carbohydrate, those starchy carbohydrates, that can really do this, creating that glycation, creating that kidney damage. And then when the kidneys start to go, right, so too do these different functions. We lose our ability to filter our blood. Our blood starts to become toxic. We lose our ability to regulate our acid-base balance. Our blood can become too acidic. We lose the ability to regulate water. We start to become swollen. We lose the ability to regulate blood pressure. Our blood pressure goes up and puts more pressure on our heart. We lose the ability to produce red blood cells. And so now we become more anemic, because we can't carry as much oxygen, and the red blood cells that we're making are being coated by sugar, so they don't work very well. So we become really tired all the time. We don't want to exercise, right? And so when we don't want to exercise, guess what? We don't want to exercise. It's really hard to get rid of glucose, because one of the main ways we get rid of glucose is by exercising our muscles. Our muscles' utilization of glucose is how our muscles get the energy that they need. So if we're not exercising because we're anemic and tired all the time, then this glucose goes even higher, right? But also activating vitamin D. Now, one of the functions of vitamin D as it relates to the kidneys and it relates to blood sugar is vitamin D is the primary agent involved in insulin production. Missed an I there. There you go. Insulin production. You need vitamin D. As a matter of fact, your pancreas has, I think to date, as far as we know, the most vitamin D receptors on any organ actually are on your pancreas. And one of the things your pancreas does, under the direction of vitamin D, so vitamin D travels to your pancreas and says, hey, we need insulin. And so then your pancreas responds and it says, okay, we can make insulin. Your pancreas produces insulin. What does insulin do? Insulin unlocks your cell and allows glucose into your cell, and that's where we make energy. And so if you don't have adequate vitamin D, again, lack of kidney function, lowered kidney function, you're not activating your vitamin D, you're not producing insulin as well, you're not getting the glucose out of your bloodstream as well, your cells don't generate energy as well. So, you know, you look at this anemia component with lack of oxygen, then you also add on top of that this vitamin D component with lack of ability to get glucose into your cell to generate energy, and now you're pretty much an energy zombie, right? You're just struggling, you're suffering, trying to get what you need. And so again, exercise is the last thing that you want to do. And so this is where at this point, most people they go on mass quantities of medicines, right? Because the medicines that doctors use, like for example, to control better insulin and glucose, doctors prescribe Metformin. That's one of the primary drugs for diabetes. And Metformin, unfortunately, Metformin causes B vitamin, folate, and B12 deficiency and CoQ10 deficiency. And unfortunately, B12 and folate deficiency cause anemia. And CoQ10 deficiency causes elevations in blood pressure, which puts more pressure on your kidney, but it also causes congestive heart failure. So it puts more pressure on your heart. So over time, that's what this particular medication does to your nutritional status. So it actually recreates the very disease that you're taking a drug to try to prevent in the first place, but it recreates that through different mechanisms. The other things that we'll see happen, in this type of scenario is they won't just go on blood sugar drugs, but they'll go on blood pressure drugs, and so to lower blood pressure, because again, when the kidneys aren't functioning, we're not regulating blood pressure. And so the same thing goes. So some blood pressure medications, there's different kinds, but BP meds, some of them reduce B vitamins and electrolytes, like potassium. Potassium, calcium is an electrolyte, magnesium is an electrolyte. People don't realize that. And these medications can actually cause deficiency calcium, magnesium, potassium, okay? And that in and of itself can create a host of different problems. If you want to learn more about these minerals, you can go watch some of my crash courses on these particular minerals, but B vitamin deficiencies as well. And one of them, particularly blood pressure medications, will reduce vitamin B1, and vitamin B1 deficiency causes a disease called beriberi. Beriberi is a form of congestive heart failure. So again, trying to save the heart through the use of blood pressure medications, trying to save the blood sugar through the use of blood sugar medications, but the byproduct nutritionally of giving those meds over time is an actual nutritional deprivation that begins to set in. It causes the disease that the doctors were originally trying to treat, and that's why nobody ever wins. That's why when people go on blood pressure medications and blood sugar medications, their diseases don't get better. Their symptoms change, or the values that the doctor's measuring in the blood changes, but they always have the disease. The disease never really goes away. They don't get rid of their diabetes. They don't get rid of their high blood pressure. Look, and we know the reality is diabetes, high blood pressure, heart disease, these are completely reversible conditions unless you have some type of rare esoteric genetic disorder in that area. These are completely correctable conditions through diet and through lifestyle. But again, as I mentioned earlier, the American Heart Association recommends a high carbohydrate diet and a low fat diet. So a high carb, low fat diet, right, which is the opposite of a low carb, higher fat diet to lower glucose, because fat has taken on most of the blame. So fat has been blamed for a lot of this problem. But anyway, I digress. So we want to understand that your kidneys can be damaged by certain kinds of medications, because these different types of medications have to be metabolized by the kidneys. So if your kidneys are already not functioning, this could be the bad move or the wrong move for you. Kidneys are also damaged as a result of an abundance, too much glucose, right? Too much blood sugar. Like, those are the main elements that can really damage kidneys. Now, the other thing I've seen damage kidneys are dietary oxalates, and we'll talk a little bit about that. And the other thing I've seen damage kidneys, gluten. And we'll talk a little bit about how gluten can damage the kidneys and in which specific ways. And then in addition to that, things that not necessarily that they directly damage the kidneys, but can prevent the kidneys from repairing and healing, and that's nutritional deficiency. So nutritional deficiency oftentimes will prevent kidneys from recovering if a person's changing their diet and trying to do the right things within their diet. And so nutrients are super critical. That's why, again, some of these medicines, long-term can become a problem because they create nutritional issues.
Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.